afternoon, everyone. It is 2:30. Welcome to Cook County Health Department's Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department's Community Engagement and Health Education Unit, and I am your host and moderator for our weekly webinars. Let's quickly breeze through our announcements, and then we'll toss it over to Communicable Disease for their update. As normal, our objectives are to update and support schools while navigating COVID-19 and answer any frequently asked questions and provide CCDPH contact information and resources. Few announcements. There is no webinar next Friday due to the Thanksgiving holiday. Everyone enjoy yourself, whether you celebrate or not, just get some rest, and we will see you the following Friday. All of our webinars are recorded and they are uploaded to our website as well as our CCDPH's YouTube page. Little housekeeping, we start promptly at 2:30. We ask that you keep your line muted. We had a little issue last week with disruption, so I have disabled the mute buttons for this time. We want to make sure that everyone can listen to the presentation without distraction. So, and also the chat is disabled until we get to the Q&A. If you would like to reach CCDPH for any reason, there's our general email address is at the top. And you can send webinar related questions and general questions. If you would like to report line lists, report communicable diseases, have any metrics questions, there's our communicable disease reporting email, as well as our website, school-related website, and our toolkit website where you can print information that you can put at your facility or school if you would like. Please send all EpiPen requests to me, Kelly Jones at kjones1 at cookcountyhhs.org. Please make sure your requests are typed and that they come from a medical professional, i.e. your certified school nurse, or someone who has been trained on the administration of the medication. Our doctor will sign a standing order and your prescription, and then it is up to the schools to fill the prescription by using the metrics or any standing operations that the school has set forth. CCDPH is also able to provide some PPEs to organizations and schools at their request. You can complete the form at the link on the slide. All the slides will be sent to you guys. And we are able to offer things such as masks, gloves, gowns, face shields, etc. You may not receive everything requested, but we are willing to try our best. We'd like to know how we can help your schools support your schools during this time getting your students vaccinated. So if you're having any particular issues or you'd like to let us know, please feel free to fill out the school COVID vaccination survey, and we'll reach out and see how we can support you guys in this effort. A few resources. There are lots of resources and events going around right now, so I only highlighted a couple, and then the rest will come in your packet that I email. So there is a COVID-19 vaccination question and answer sponsored by the Illinois chapter of the American Academy of Pediatrics. It's next week, so I thought that this would be a good resource that you could give to your parents. So I will make sure that this has already happened. However, all of these events are recorded to our Facebook page as well as our YouTube page. So I thought that it is a great resource for Spanish-speaking communities. They can have it's an Ask the Doctor session that happened on Wednesday, presented by Rincon Family Services. But again, it is on our YouTube page as well as our Cook County Health Department Facebook page if you'd like to share this or watch it yourself. Also, another Spanish-speaking event. It is sponsored by West Suburban Action Network. So I'll make sure I send this, and as well as the English slide for you to share with your families. So here's just a screen grab of our Cook County Health Department calendar. We have lots of events going on. We have really tried to make sure we immerse ourselves within the community and partner with other community-based organizations in order to really get out there and try to support our community. So this is just a little screen grab of what's going on the next few days. But if you go to the following link, you'll see all the events that we are at coming up. If you would like to request an on-site school clinic, the link is at the top of the page, or if you have any questions, you can email the project managers directly and they can help you to set up a school-based clinic. Also, this community Mobile Community Playbook is a really good resource to try to help you, give you some tools if you are setting up a vaccination event. And then that way, you'll know the best way to set that up. Here's some more educational resources that you can download at your leisure. And just a little link to our My Shot YouTube campaign. We went out into the community and we just videotaped the community while we were having vaccination events and just asked them to report back on why they got vaccinated and what their experiences are. We're also working on that for the pediatrics population. We thought that'd be a good way to get kids involved. Some more videos on our YouTube page. And if your school has an existing COVID-19 testing program, if you wouldn't mind filling out that survey, we would like to know about that as well. If you are interested in requesting the Binax Now rapid antigen COVID testing, you can do that at the following link. IDPH is no longer accepting applications because they are just overwhelmed, so you must request that through us at CCDPH. Information about to set up the Shield saliva testing can be made. That request can be made through the DPH antigen testing at illinois.gov email address. And if you would like someone to come speak to your school about COVID-related subjects, please fill out the request form at the following Google Doc. We are also able to, through our partnership with Kaizen Health, it's called Destination Vaccination. We are able to give free rides to go get your shot. So if you know someone who'd like to get their vaccine, but they don't have the transportation, they are able to call that 833 number and request that, as well as they can call that 833 number to request an in-home vaccination. It's just some more resources at the bottom of the page. So I want to thank you for your time. And before I toss it to Lex, I am going to toss it to Palette.
Thank you, Kelly. To those of you who don't know, I am the program manager for Vaccine Preventable Disease program at Cook County Department of Public Health. And I've been involved with COVID investigations since the beginning of the pandemic. And I just wanted to make an announcement that my last day at Cook County Department of Public Health is next Wednesday before Thanksgiving, November 24th. And I wanted to thank all the school community for being so patient with us and answering our questions when we asked for many clarifications, and for being a good partner to us. So thank you very much. It's been a pleasure working.
Thank you, Palak. You will be missed. Congratulations and good luck on your new endeavors. I'm going to toss it to Lex. Hi, Lex.
We're gonna miss you, Pollock. All right, so based on the feedback we've gotten from the surveys so far, a majority of people have asked for more time at the end for Q&A. So this is gonna be as short as possible with just the new updates, because nothing too much has changed, and some recommendations for the holidays as we get into that season. You guys know this info by now, but just when you're contacting CCDPH, it's important to put some important details in the subject field of the email. So if you're reporting a case or contact to us, put that you are reporting a case or contact from your school or district. If you're reporting an outbreak, certainly put that in the subject line. That's really important. And then if you need guidance, just write guidance in the subject line and where you're asking from as well. That just helps us filter out and prioritize emails, especially if, since Pollock is leaving, there's a good chance we're going to be creating email filters and stuff to make sure each email goes to the right person. So make sure you put what it is you're emailing about, and not just like question from District 200 or something like that. Because that could be question about an outbreak, question about a case, or you need guidance. So just be specific in the subject field. That would help us out a lot. All right, you guys are familiar with the website by now, I'm sure. And then I wanted to plug this again from last week. We are asking you guys to fill out a survey and provide us with some feedback for this webinar series that we're doing. It asks questions, I have it pulled up next to me, about, you know, whether we're providing the right kind of content, whether you want different sections, or different topics, or some parts to be longer, some parts to be shorter. The classic, this could have been an email, let us know. Or if there's something you don't understand and you want us to go over, there's a place for you to write that into. So we are really trying to respond to your feedback and tailor this to your needs, and also make sure that we are communicating appropriately with you guys to the best extent possible. Obviously, this has been a learning process for everybody, so I'd be really happy to get your feedback. I will put the link for it in the chat, but also here's a QR code when this gets distributed, and the same link is on the slide. All right, you guys kind of know the drill with outbreak testing. Just kind of be asking yourself and the people who have become cases around the same time of each other, like if they could have been exposed, outside of the school setting, like a party or a church gathering or things like that. And then, as always, as we've said many, many times, dates of exposure, dates of tests, any dates you can give us, make it really, really helpful, so that there's less back and forth email and we can be a little bit more straightforward with any kind of directions. And we've got this helpful form to help determine whether there is a possible outbreak. So goes through, are there 3 or more cases? What are the dates? Just some information. With the most, if you can hear the lawn care service, I do apologize. They usually don't work this late in the day. So then if you guys need help with outbreak testing and things like that, if test to say is going to be possible, just a nice form to help walk you through that process and also give us really good information. All right, just so you guys know, if you didn't see it in the news, booster doses are now recommended for all adults, as long as they meet the time frame requirements. So it's not just health condition or occupation specific. You guys were already all eligible, but in case you've got family members or people were just waiting until it was available for everybody, now anyone 18 years or older who's 6 months out of their mRNA vaccine or 2 months out of their Johnson & Johnson vaccine can go and get a booster from anywhere. It should be free. So CDC okayed it, IDPH okayed it, we're good to go here. And then I just wanted to emphasize that the co-administration of COVID vaccine, whether it's your first, second, or booster dose, and your flu vaccine, is totally safe together. And a study just came out looking at how this affected younger kids, and it was totally safe for them. There were no more side effects related to the vaccine than there were for just one. And obviously the injection site's going to be different for both. I'm still waiting to get my booster because I couldn't get an appointment until next week, but I got my flu shot and my arm didn't even hurt. So having them together, totally fine if you want to shorten your visit. All right, I think you guys have gathered by now, we are at the beginning of our holiday / colder weather surge. We are not on the best trend, especially in our younger age groups, particularly because our older people are pretty well vaccinated and younger people are not, but we're seeing kind of record number of younger cases. And that's mostly because older people are protected, but also then that means the susceptible people are our young people. So it's really important to, if your kid is eligible or you have students who are eligible, talk to them about getting a vaccine. It's going to be really important heading into the holidays. I know that if people were gung-ho about the 5 to 11 years getting vaccinated, they won't be fully vaccinated by Thanksgiving, but they will be by some later holidays. So that's something to keep in mind. We are still in high transmission. We have a very high weekly case rate. We were dropping there for a while, but we're back up. The percent of the total population with a completed vaccine series has gone up a little bit. And as I mentioned before, the completed vaccine series won't be complete for that younger age group that was just approved. So we are expecting that percentage to go up after Thanksgiving. But just something to keep in mind, that that's where we're at still. That's how many of the population have decent protection. against the coronavirus. Still at the same place in terms of outbreaks in schools. We are seeing a lot right now just because everybody's inside and we're starting to see the impact of Halloween and things like that. And it's Halloween, Thanksgiving, and then all the winter holidays. So we will continue to see more outbreaks probably for a little bit. So be prepared for that. We actually had some more states released from the no-go list. And it's mostly in these Gulf Coast states and Tennessee, if you've got relatives down there and you want to see them for the holidays. As a reminder, if you are vaccinated, it's going to be safe to travel, especially within the country. But if you're unvaccinated, traveling to any of these orange states means there's a good chance whatever community you ended up in is a strong possibility of exposure. So unvaccinated people should stick to Illinois as much as possible, knowing that we are also, we would be considered orange as well. So limit travel for the holidays for unvaccinated folks is my advice, but we will get into the holiday recommendations. Last year when we weren't vaccinated at all, come Thanksgiving, my mom just made our family dog an entire turkey, and that's what that picture is. But I just wanted to go through a couple of different scenarios for you guys and suggest any mitigation measures that you might feel comfortable with. So if everybody at the holiday gathering is going to be fully vaccinated, and that's not including booster doses, that means 1 of J&J 2 weeks out or 2 of an mRNA vaccine 2 weeks out, that's fully vaccinated. You can party like you did before the pandemic. I know, responsibly, but still, it's a very safe situation for everybody. If the gathering is going to include a mix of fully vaccinated people and people who are between doses or partially vaccinated, including those 5 to 11-year-olds, if it's just the kids who are partially vaccinated and all the adults are fully vaccinated, again, very safe situation. Proceed to have your gathering. If it's the adults who are partially vaccinated, especially if those adults are pregnant women who are between doses, studies have shown that for pregnant women, after 2 doses, their immune system responds really, really well, like the rest of us. But after the first dose, because their immune system is suppressed a little bit due to the pregnancy, they don't respond as well. So it's really important to protect pregnant women who are between doses. So caution is going to be necessary in that situation. If you know there are going to be some people at the gathering who will be unvaccinated, if it's just the kids under 5 who aren't eligible, that's still going to be a pretty safe situation. All the vaccinated adults and older kids are going to be protecting those under 5. If it's adults who are unvaccinated, whether that's because of personal beliefs or because of a medical condition, caution is obviously going to be really necessary. And my first suggestion when I'm saying caution is necessary is get tested within 2 days of the gathering. Home test is fine, antigen test, PCR, fine. Just get tested before attending. People who feel sick, regardless of vaccination status, if you feel sick, you should not attend, whether that's because of COVID or maybe you've got the flu or you've got the stomach flu. No one wants to be getting sick after Thanksgiving gathering. So if you feel sick, do not attend. Full stop. Obviously, ventilation and airflow will be important when you're taking precautions. If you've got like double doors out to a deck or balcony, weather permitting. I know it can be very cold come Thanksgiving, but as much as possible, if you've got like one of those big heat lamps, maybe spend some time outside if you can. So airflow, really important. Staying socially distanced is a good way to still see everybody. But be a little bit more spread out if you have the space. And then, especially if there's going to be elderly people or immunocompromised people, or again, those who are like pregnant women who are only partially vaccinated, it's a good idea if you know you're going to be within 6 feet for any kind of period of time. Masking up is the best way to protect them if you're still going to see them. So those are some ways of taking precaution. You don't need to avoid gatherings altogether. You just make a plan with your loved ones to be as safe as possible. And I know those can be some difficult conversations. but they are important conversations to protect yourself and protect the people that you love. And feel free if you want to, I think IDPH might have a holiday newsletter, but you can certainly send out a newsletter to your families or students with some recommendations on it. If you don't subscribe to this already, there is a newsletter called Your Local Epidemiologist, which I would highly recommend. A lot of these suggestions are from that newsletter that gives really good and accessible information if you wanted to spread, like they have a document that you could disseminate with these holiday recommendations as well. All right, now we're just on to our references because we didn't have any submitted questions this week. So here's for the test to stay flowchart. I know you guys are pretty familiar with this at this point, but I know that can be a little bit of a confusing situation. So always good to reference with the links attached to this. What kind of test results are acceptable in high and substantial transmission, which we will be in for a little bit. What we're accepting, the SHIELD FAQs in case you have questions about that, what to do if you've got a symptomatic sibling, but one sibling is feeling fine, what quarantine options might be appropriate for different situations, just general guidelines. The sports guidance was updated. I went through it and it's not all that different than what we've all been practicing. But if you have any questions about it, obviously feel free to ask and we can go through it. And then since people are thinking about getting flu shots or younger kids are thinking about getting their COVID shots, some guidance about what could be a vaccine side effect and what symptoms actually would result in somebody being excluded from school or work that are likely not due to the vaccine. Because we're going to see, from a vaccine, we're going to see the same generalized responses. And then if you're here from a daycare or pre-K, guidance that applies specifically to those settings. And then as a reminder, just from what I said before, please be really specific in your subject lines so we can go into that email having the right information for you. And with that, I will stop sharing and take a look at the chat. I saw someone asked for the sports guidance. It looks like Pollock already handled that. So thank you so much, Pollock. And I will also post the survey form in the chat as well.
Lex, I wanted to, if you can go ahead and explain the test to stay. I am still, receiving some calls and emails. There is some confusion about test to stay. Test to stay is only, it's a quarantine option that so that we can continue to have our the students come to school, not miss out on school. And it's not applicable if the students are not able to be socially distant and consistently masked. So when we say test to stay, it's an option rather than somebody's in, like, it's please discuss with us when you do try to implement test to stay, just so we can make sure that it's being done correctly and among those who are able to be socially distant and masked, because otherwise this option is not helpful. And can you, so if you don't mind going a little bit more in detail, Lex, if you can.
Sure. Maybe I will, let me see if I can pull this up and we can zoom in a little bit more. All right, hopefully that's big enough for everybody. So first question, were the unvaccinated close contacts and the case fully masked for the entire exposure period? And this is the most important question to ask, because if they were masked, that makes that close contact a really low risk to anyone else they might come into contact with if they do test to stay. That's why it's so essential. It's putting close contact in a risk category based on their exposure. So automatically, if someone wasn't masked or they weren't properly masked, that's automatically not an option for test to stay. And if you can't, like you didn't have supervision in that scenario, like the bus driver didn't see if they were fully masked on the bus and he didn't remember if the windows were down and there was good ventilation, or you were in the lunchroom and you're not really sure if those kids in line or eating really close to each other were masked. If you're not sure, don't do test to stay. There are other shortened quarantine options to get kids back in school as fast as possible. This is for low risk situations. So if they are masked, then the school is going to have the testing on site. So that's important, on site at the school on days 1, 3, 5, and 7 after the exposure with an approved test. That could be Binax, that could be Shield. Those are both good options. And if you're working with Shield, they will help you through this process as well. So those tests have to happen on site, and sometimes day one might not be known that there was an exposure yet at that point, and that's okay. But if you're getting into day 3, 5, and 7 post-exposure and you didn't know until like day 5 that there was an exposure, this isn't a test to say situation anymore. That's bending it a little bit too much. But if you are able to test on site, more or less on days 1 through 7, at those intervals, then proceed with test to stay. And as long as the test results stay negative, then that person can stay in school, make sure they're, physically distanced as much as possible. So that's 3 feet in classroom settings, 6 feet in the lunchroom settings. That is, in the lunch setting especially, very important. They are not barred from taking the bus, although if it's not a burden on their families to take them to school for that period of time, that is preferred. But obviously we don't want transportation to be the limiting factor of someone being eligible for test to stay. They have to be fully masked indoors, and like if it's, I don't know if people are still doing outdoor gym at this point, but for like outdoor gym or recess, if they're doing an extracurricular activity, they should be masked, especially if it's indoors. If it's outdoors, if you can devise a way for them to participate and stay quite distanced, at least over 6 feet away from everybody else, they can safely remove their mask outdoors. If not, if like you're gonna watch film outside or run drills or like have them set up the cones or something and be near the other players, then they should be masked for the full testing period. So that's kind of how you run it. It's a little intimidating at first, but I feel like once you go through one person doing test to stay, you'll probably have the drill down. But, just remember, if you're not sure or you find out a little late about the exposure, there's still the 7-day shortened quarantine and the 10-day shortened quarantine. So there are other options for you if you are intimidated by test to stay or you're just not sure it's appropriate to use. But it is a good option for the people who have really low risk exposures. So hopefully this flowchart helps kind of with some decision making. And let's see if there were any questions about that. Give me 1 second, folks, to catch up. For anybody asking about Binax, we are contacting them and waiting for a response to see about the extended deadline. IDPH is contacting them, so we will let you know. The tentative answer is it's probably fine, but we want to make sure we have that in writing before we give it the final okay. Pollock, do you know where they can find the outbreak form?
Yes, so the outbreak worksheet that we created, I think that's the one the question is about. We are going to be talking with our director to see if we can post it up on the website. But however, for now, if you have a possible outbreak, just send us an email, with the subject line possible outbreak, give us a quick rundown of the situation, and then we'll email you the outbreak form. At least for now, but we'll try to ask our director to post it on our website so it's easily accessible, the school health website.
Yeah, I think as you guys have gathered with IDPH, it takes a series of approvals to get something posted online, so it might be a little slow, but people are working on it, I promise you that. Next question I see that pertains to CD. looks like there's a home testing brand called Q. I have not heard of it, but home testing, as it pertains to schools, can only be used for employees that need to be tested on a weekly basis because they're not vaccinated. Home tests can't be used to clear a student or staff member who has had symptoms to return back to school or work. So regardless of the brand of home test, that's not appropriate for return to school or work, but it is fine for the weekly monitoring for unvaccinated staff. With case counts on the rise, we are concerned with schools offering intramural sports, basketball, volleyball, and wrestling. How can we contact trace if a positive case participated in these activities? So you can correct me if I'm wrong, but my understanding of intramural sports is that it is usually just that school and their students who are interested in participating playing against each other, and those should be supervised settings. So if you are going to contact trace in that setting, you need to have a sign-in sheet with those kids who are coming. You need to know which adult was supervising that situation, and who's making sure that, especially with like basketball, they're well masked. My strong recommendation is not to have intramural wrestling. Wrestling is not a sport where you can be safely masked because it will become a choking hazard. So official wrestling is on. It is not the safest sport, but it is on. But intramural wrestling is not a very good idea. Basketball, volleyball, things like that, as long as everybody's masked, that should be fine. Just keep track of who's there, and make sure who's coming into contact with who, especially if you've got kids changing into in the locker room or something. You might want to have like a locker room sign in too. Or if there's any kind of bus transportation, you also need to know who was riding the bus, when, with who. So that's how you can safely enable intramurals.
But sorry, I just wanted to say we did receive an email about possible outbreak in wrestling team, and it's a very high risk sport, so we don't recommend during this transmission level.
Yeah. It looks like we've got some issues with Binax, and I'm gonna write this down to ask because I do not know the answer about expired Binax tests, and I will figure out who to ask about those questions.
I gave the email of Dr. Jackie Corpix.
Right.
So you can direct. She's our medical director for COVID response. So any question concerning Binax and expired dates, you can refer to her.
All right. At the beginning of this meeting, you mentioned to put in the subject line COVID case or something like that to bring attention to it if sending a question. When we list our blind list, do we still only list the name of the school and the town in the subject line?
We want the school name and the district number, just because there are some schools that have same names but in different districts. So because we tend to forward this to our contact tracing team, then it goes to the same person. It's just easier for us to streamline the process, and for you to also receive the answer from the same investigator or contact tracer.
Next question is, will the same quarantine guidelines apply to vaccinated children in that younger 5 to 11 age group? Yes. So if they are fully vaccinated, they will not have to quarantine. They'll just have to, monitor closely how they're feeling for the next 2 weeks. It's never a bad idea to get tested like 5 days after an exposure. But if they're fully vaccinated, they will not have to quarantine. Same as everybody else. It will also help if, there's a case of the sniffles or something too. Currently, we are using the 14-day quarantine period. Are we allowed to use shortened quarantine periods? So the answer is yes. 14 days is the golden standard because in our documented cases of COVID, the longest it's, taken somebody to become symptomatic was 2 weeks. So that's the gold standard. Most people who are going to get sick, become infectious within a week. So you are allowed to use shortened quarantine periods, but the shortest you can go is that week period, and that is assuming you feel totally fine, you haven't developed symptoms, and you have a negative test results. If you stay totally fine, no symptoms for 10 days, that's also a shortened option where you don't have to get tested, but it might just be easier to take that 14-day quarantine approach if, no one is objecting to it, or you're not in a situation where like test to stay would be really appropriate for a student's learning needs or something like that.
Can I add one more, Lex? For shortened quarantine, those persons in the shortened quarantine, they must remain consistently masked and socially distant until day 14.
Yes.
Then only it would be a good idea.
I will turn it over to Kelly with anything, and we'll wait to see if there's any more questions that come in. I hope you guys have a really good holiday, and somehow we will see you in December next time.
That sounds bizarre, doesn't it? I was thinking the same thing. So I just thought about it. Last week, I made an announcement that our mobile team was at Sauk Village Community Center doing pediatric vaccine as well as you could get your first, second dose or your booster. Because we won't be meeting next week, I wanted to announce that they will be back December 3rd and 4th at Sauk Village Community Center. The flyers aren't available yet, but by the time we meet in December, it had already passed. So I want to make sure that everyone is aware that that is available. As well as we had the Cook County Sheriff's Department with the comfort dogs there. And it was a really great resource for the kids. It was so sweet to see the dog comforting the kids when they were upset. And the sheriff was great at his job. So if you have any families that would like to come back and get their second dose, as well as we have a grant program going on that if you come out and you are 12 and older, getting your first dose, not boosters or anything like that, your first dose, you can get a $100 gift card. So I will make sure that I repeat that information again, as well as a reminder that we are not here next Friday because of the Thanksgiving holiday. So I think a couple more questions went into the chat, so I'll let Lex or Palak address that.
I think we already addressed the vaccinated persons being tested 5 to 7 days after close contact. Yes, in situations of outbreak, if there's an exposure to a known case or if the person has symptoms. And Kelly, someone wanted a number for EpiPen request.
Okay, any EpiPen request, you can send me an email, kjones1@cookcountyhhs.org. That information is also sent out on the slides if you don't get a chance to. Thanks, Lex. You are quick. Write that down. You guys are super quick. That's also going to be sent on the slides as well. If there aren't any other questions, that is it for me. I don't know if Palak, you wanted to reiterate your announcement for those who may have come in after before we end.
Yes. Thank you, Kelly. I am so sad to say I'm leaving Cook County Department of Public Health next. My last day is on Wednesday before Thanksgiving, November 24th. I'm really going to miss our interactions, a lot of back and forth. I know it's been very stressful, but I've learned so much, and I've learned how much partnership makes a difference, and having an open mind and knowing situations are different for everybody. So it was a great learning experience, and I hope this pandemic ends soon. I am going to Chicago Department of Public Health. That's where I'll be working. But again, I'll be working with COVID data. But I'll continue to participate in IDPH webinars so I can keep in touch. And thank you so much. Good luck to everyone.
There are some well wishes in the chat, Palak, and we are going to miss you. Thank you for all your hard work and good luck with everything. We will miss you too. Change is good, onward and upward to better, bigger and better things. If there aren't any more questions or there aren't any more announcements from Lex or Palak, we're going to adjourn for today, and we will see you all on December 3rd. I can't believe that. No, there is no webinar next Friday, and you guys enjoy your holiday week, whether you celebrate or not. Just enjoy the time off. Be well and stay warm. It's freezing outside. Take care. Bye-bye.